Module Overview. Nutrition, feeding, and hydration are foundational to recovery, strength, immune function, and overall well-being in patients, especially those who are bedridden, elderly, critically ill, or disabled. Proper bedside care includes not only serving food and fluids, but also understanding the nutritional needs, dietary restrictions, and safe feeding techniques required for each patient's unique condition. Caregivers and healthcare assistants must be trained in both clinical nutrition awareness and empathetic feeding approaches, recognizing that this aspect of care directly affects patient outcomes, emotional state, and dignity. Importance of nutrition and hydration in patient care. Good nutrition plays a vital role in tissue repair and wound healing, energy maintenance for movement and recovery, preventing malnutrition, anemia, and frailty, boosting immunity to fight infections, maintaining mental alertness and mood stability. Hydration regulates body temperature, supports organ function, prevents constipation, urinary tract infections, and delirium, ensures drug absorption and circulation. In hospital settings, dehydration and undernutrition can quickly lead to complications, especially in elderly or post-surgical patients. Every caregiver must recognize this risk. Types of diets in clinical settings. Each patient may be on a specific diet plan based on their condition. These include clear liquid diet, water, broth, tea, used before or after surgery or digestive issues. Full liquid diet, milk, creamy soups, puddings, transitional diet. Soft or pure diet, for patients with chewing or swallowing issues. Low sodium diet, for hypertensive or cardiac patients. Diabetic diet, balanced meals with controlled sugar and carbohydrate intake. Renal diet, low in potassium, sodium, and protein, used in kidney failure. High protein diet, for wound healing or post-surgery recovery. Tube feeding/enteral nutrition, for unconscious or critically ill patients. Caregivers must know the rationale behind the diet, restrictions, and risks of deviation. Feeding techniques for dependent patients. Patients with limited mobility, weakness, or paralysis often require feeding assistance. Guidelines include patient positioning, sit upright, minimum 45 to 90 degrees to prevent aspiration. Pacing, feed slowly and allow chewing/swallowing time. Observation, watch for coughing, choking, or signs of aspiration. Bite sizing, offer small manageable amounts. Respect and interaction. Talk to the patient and offer choices where possible. Utensil safety. Use adaptive utensils for tremor-prone patients. Clothing protection. Use bibs or towels respectfully. Post-feeding monitoring. Keep patient upright for at least 30 minutes. Caregivers must be trained to feed with empathy, never rushing the process or ignoring the patient's responses. Monitoring food and fluid intake. Accurate monitoring is crucial in preventing malnutrition, dehydration, electrolyte imbalance. Caregivers should record quantity and type of food consumed. Note any refusal or aversion to certain foods. Measure fluid intake, oral and IV where applicable. Communicate with nutritionists or nursing team. Special attention must be paid to diabetic patients, glucose spikes, cardiac patients, fluid overload, kidney patients, fluid restriction. Dehydration, signs, risks, and prevention. Symptoms of dehydration include dry mouth and cracked lips, reduced urine output, sunken eyes, confusion or lethargy, low blood pressure, rapid heart rate. Preventive steps. Offer fluids regularly, even if patient doesn't request. Encourage sips after meals and meds. Monitor for fever or diarrhea. Increase loss. Adjust fluid types to patient's restrictions, e.g., no sugary drinks and diabetes. Aspiration risk and choking prevention. Aspiration, food or liquid entering lungs, is a medical emergency and a common cause of pneumonia in bedridden or elderly patients. Prevent it by ensuring upright feeding position, avoiding straws in dysphagia patients, consulting speech therapists for thickened fluids, using chin tuck posture in high-risk cases, halting feeding if patient coughs, turns blue, or gurgles. Always have suction equipment and emergency protocols ready. Cultural, religious, and ethical considerations. Feeding care must respect religious fasting periods, e.g., Ramadan, cultural taboos on certain meats or foods, vegetarian vegan preferences, patients' right to refuse food. Ethical care means never force feeding and always offering dignity even when feeding becomes a challenge. Documentation and communication. Record, type and volume of food fluid consumed, patient's appetite or refusal. Adverse reactions. Any feeding difficulties. Time of feeding. Communicate with dietitians, nurses, physicians to adjust diet plans or investigate feeding issues.